Right to Know is a national nonprofit that helps people impacted by DNA surprises. Those people include those impacted by donor insemination. The CEO, Cara Rubenstein-Dyarin, spoke with me about the nonprofit and its mission.
A Pew study found that 1 in 7 Americans have taken an over-the-counter DNA test, and that 1 in 4 of those are finding close relatives they didn't know about. But what's happening that I don't think people realize is when you do take an over-the-counter DNA test, a lot of times people are discovering that one or both of their parents who raised them aren't genetically related to them.
Dyarin wants to help people suffering through her nonprofit Right to Know.
Right to Know basically supports people with DNA surprises, genetic identity issues, and misattributed parentage. Misattributed parentage occurs when someone discovers they're adopted, conceived through assisted reproduction, or what we call a non-paternal event, NPE. Some people also refer to it as not parent expected, but we really narrow it to non-paternal event. It's people who discover their father isn't their father, and that was obscured or hidden from them.
The kind of services it provides are mental health initiatives, education, and advocacy work.
So we provide a hotline for people to call or an online submission form where we'll reach out to them. From there, we can help people find the resources they need to heal. So for example, we help people identify their genetic parents for free, because without knowing who you are, it's really hard to move forward. We will connect people with a licensed therapist if they want that. And we have a mentor program. So if you discover, for example, that you're a late discovery adoptee, we will pair you with someone who is also a late discovery adoptee, but a little further down their healing path. And then we also answer general questions for people. And so mental health is really our first area because it's so important that people have what they need to heal from this discovery. We also provide classes for mental health therapists with continuing education credits, because we found, we did a study, a majority said that while about 40% had seen a therapist, but more than 70% said the therapist didn't have the training needed to help them because this is such a new area. So we created a series of classes for therapists to take so they can help our community better. Then we have education, and education really has two prongs. Education for those of us making the discovery. Those DNA tests can be very confusing along with your matches. And like, what if I want to change my name? How do I do that? Or just so many different things about education. So we try to help educate people making these discoveries and the family that raised them and the family they're reaching out to. But then there's also the general public, because this is such a new thing. Most don't understand the impacts of such a discovery. And then finally, we do advocacy work. We try to work with other organizations that have their fingers at all involved in genetic identity to educate them again about these issues.
The nonprofit is also working to create legalities around fertility fraud.
We did pass broad-based fertility fraud legislation in Iowa, but other legislation in the past has just focused on doctor fertility fraud. And that's where someone discovers that their mother's fertility doctor is also their father. And while this is horrific, and most people are surprised that it's not already illegal, there's not a lot of cases of this going forward, because you have to remember, when you pass a new crime, it's for that day going forward. You can't retroactively create a crime. So we're looking at doctors who would use their own sperm going forward.
It's not federally illegal to use your own sperm or other sperm during artificial insemination.
In gamete provision, the recipient parents do not get to meet the gamete provider. And so it's really important that they have access to accurate information. And you know, when someone agrees to assisted reproduction, they are agreeing to having a doctor perform intimate acts on them, and they need to understand that it is a safe environment and they are getting precisely what they ask for. And so what you're talking about is an ethical question.
Dyarin says some people consider artificial insemination as a form of medical rape if they do not know what sperm is going into their body.
The doctor is using something other than what the patient requested. It is a form of medical rape. It's sort of a new area. I get some pushback sometimes from legislators about that, but every mother who's had something inserted into them other than what was requested feels that it's a form of rape. And somebody's making that choice. They're taking that choice out of you. And really, rape is about consent, informed consent. You do not give consent. And these patients have not given consent.
Right to Know is working with people in individual states to come up with local and eventually federal legislation to create more boundaries for fertility clinics who created fraud.
No laws and regulations associated with assisted reproduction. Animal husbandry in the United States is more regulated. Your nail salon is more regulated, which is just so crazy because we're making humans. And there's so much fraud and negligence in the process of doing it, partially because people thought nobody would ever know. You got your baby, what's it matter? And so, and the part of the problem with that is people aren't making those discoveries until they're an adult. When they do an over-the-counter DNA test, mom and dad go in and request donor 545, and they have a little printout. Maybe they're open about the fact that their child was conceived through gamete provision and tell their child that, which is the best way for the mental health of the child, to tell them from the beginning about their unique conception. And the child thought she was half French. And then, when she's 25, she gets married and gets a ancestry.com test and discovers she's not. That was 25 years later that you don't discover the fraud. And we have so many instances of fraud and negligence that people are reporting to us. I think we're just in the tip of the iceberg of these issues, which is why Right to Know started with legislation surrounding fraud and negligence in assisted reproduction.
Samana Sheikh, TV reporting.